Okay, our first speaker on this panel is Deborah Quinn.
Good morning. My name is Deborah Quinn, and I am a familiar ALS patient. I'm a dedicated ALS advocate and one of the founding members of Hearts for ALS New York, a nonprofit dedicated to helping those living with ALS within Western New York. We thank you for allowing us to present to you today. There are many different viewpoints in the ALS community, but the important fact is many changes need to be made in order to find a treatment to cure this horrible disease. As a member of a familiar ALS family, we spend our lives watching, waiting, and hopeful for a breakthrough. My motto is I'd rather do something to be effective to the change than to do nothing at all. Addressing the following concerns to the panel is a good starting point. Please consider taking away the requirements. The patient must have been diagnosed within 24 months to be eligible for these trials. Currently, I'm excluded from 90% of them. Many patients do live today 5, 10, 15, or 20 more years. Evaluate the rule limitations that often prevent ALS patients in such areas from participating in clinical trials. What about considering technologies such as FaceTime, Skype, webcasts to at least into the introductory phases of clinical trials? More patients would participate if they didn't have the financial burden to attend trials when they live several hours from the nearest ALS clinic or planning a ride or a fly to the current clinical trial site. I'm currently 3 hours from a certified clinic. Allow patients with a diaphragm pacing system to participate in clinical trials. Allow patients to continue with drugs between the trial phases. Researchers talk about finding more genetic clues, but where and how are they being used to further the clinical trials? To me, this is one of the highlights in the past few years for familiar families have so much to share. Most importantly, I believe in order for the FDA panel to help us in a familiar ALS community, you first must understand who we are. I'd like to share with you what has brought me before you today. In the past 3 years, I and others in the ALS community have discovered that we are members of one of the largest ALS bloodlines on record to date. Through genealogy, we have learned that our combined losses are 68 family members. Across 3 families, 13 generations. I have to share with you my story so that you understand who I am, who's beside me, and who will come after me. My message is about change and never closing the door on hope for this disease. I was only 13 years old when ALS became a part of my life. It was 1977, and I was staying with my grandparents, and I overheard them talking about great-grandma's sister Ginny having the creepy crawly disease. Back then, ALS was often called the consumption of the nerves or the crawlies. Grandma said Ginny was losing her ability to swallow, and her skin was crawling as if bugs were underneath it. I remember thinking, wow, Great Aunt Ginny has bugs in her body, and I hope and pray I never get that. Ginny passed away 3 months later from bulbar ALS, and the door was closed. Little did we know the door would reopen in just 2 years later in 1979. This time it was my Aunt Bonnie, Grandma's daughter, was sick. A beautiful 38-year-old divorced single mother. Her 4 children ranged in ages 11 to 17. We didn't know how to properly care for her, but my mom and my grandma did the best they could. Bonnie's primary caregiver became her 13-year-old son. Could your 13-year-old son do this? Bonnie's primary caregiver and my mom did all that they could, and she passed away 5 months from diagnosis from lung onset. The door was closing on ALS again, but I asked a few questions this time, even at a very young age. Grandma said there was this muscle disease that seemed to be in her family that caused the muscles to crawl and weaken, and there was nothing the doctors could do. She showed me the 2 pages that the doctor had given her on information, but that was all she knew about this thing we call ALS. A decade later, in December 1989, my dad, Grandma's son, took a horrible fall down the icy front steps of his house. He believed this was the onset to his ALS symptoms. My dad was also a veteran, and in 1991, I lost my dad to limb onset. He lived 11 months from diagnosis. There was still limited information and resources available for my family, but my mom developed creative methods to make it easier to care for my dad. After all, this was her 3rd time. In 1996, my grandma died of bulbar ALS. She lost her speaking and swallowing abilities before her limb functions. She also suffered from frontal temporal lobe dementia, sometimes associated with ALS. This was a hard thing to swallow because my grandma was my prized possession. She was a family monarch with a family history of a mysterious disease, and she always felt this affliction was her fault. Once again, with Grandma's illness, we held questions, but no answers. My family cared for Grandma, and we did on our own the best we could, and the door was closed. Never in our wildest dreams did we ever think that ALS would reappear in our lives. The hardest part is to tell you about my little sister. She was 38, married with 2 children, 8 and 11, when the onset took her life. My mom was a pro by then, and she became Rhonda's caregiver 24/7 for 7 months. After 2 misdiagnoses, Rhonda thought she would be all right. We shared happy news on a Valentine's Day, for after all, she had been to a certified ALS clinic. But upon a 3rd opinion by Dr. Stan Appel, she was diagnosed and confirmed to have ALS, and he told her probably 6 months or less to live. But Rhonda didn't leave us without making a change, and with the help of Dr. Stan Appel, she had DNA testing done to discover our biomarker, and we are an SOD1 family. The research has opened the doors to the rest of us. I began my fight with early ALS symptoms in October of 2009. It took me 3 months to tell my mom she would lose another child to ALS. I have a wonderful family and friends who have helped me fling the door open as we discover research and more information. We became involved and wanted to make a change. I've brought awareness into my community. I will not settle to keep the door quiet about this disease. It is hard, but I am the voice. I have 19 other family members who will share that 50-50 chance of developing inherited ALS. For them, for all the familiar families, for everyone, we need to seek the change as each door we may walk through may lead us to a cure. Beyond that role of an ALS patient, I am a mother. I am fighting for my children, my daughter, and my son. As the years have passed, I have not seen enough improvement or hope for our next generation. We encourage them to participate in active research, but what hope do we really offer them? In 1990, the doctor who diagnosed my father said a cure would come in 5 years. He was so sure of it. He urged us not to worry, but if our concerns were great, to stop passing on this disease, stop reproducing, was the only thing that he offered us. 22 years later, ALS is still the orphan disease. And the older we get, who wants an elderly orphan? The challenge and the risk are perceived as less when going into a common disease. ALS is a variety talent show. No 2 patients are alike, and therefore clinical trials should be extended to those who have been excluded. For familiar ALS, what about those in our families that have braved the results of testing and are positive for this genetic mutation? The door is open wider than it has ever been to talk about ALS. I am the first in my family to be on Laudatech. Do we know that it's helping? In my opinion, I say yes, but at the expense of more than $1,000 per month, we often can't afford this drug. Will that change when the patent is up in June of this year? In closing, I ask you to listen to our request. I'm begging you, there has to be a change. We are the ALS warriors. Surrendering is not an option. Our fears are so great for a reason. As our bodies become this consistency of an overripe banana, we have no time to waste, no time in waiting, and the decision and changes have to come. Thank you.
Thank you. Our next speaker is Kristen Quinn.
Good morning. My name is Kristen Quinn. I'm from Arlington, Virginia, and I am 26 years old. First, I would like to thank the FDA for hosting this hearing. I think the overwhelming interest has already demonstrated that this is a very welcome and long overdue opportunity for the ALS community. You just heard from my mother, who opened your eyes to the unique circumstances of approximately 10% of patients suffering from familial ALS, the genetically inherited form of the disease. I would like to draw your attention to an even smaller subset of the ALS community, the next generation in families afflicted with an ALS gene mutation. ALS has been part of my vernacular since the age of 5, and the timeline of my life is full of cracks marking the occasions where my father sat me down to share bad news, each time related to ALS. I have not yet undergone DNA testing for the SOD1A4V mutation, but I intend to do so. It is a terrifying step that I've been working hard toward preparing for. This is because living in fear of your own body and staring down the oncoming freight train that is ALS can at times be mentally crippling. By the time my mother and her family understood beyond a reasonable doubt that ALS was being passed down through the generations, she was already married with 2 children. And over the years, some cold doctors and counselors have suggested we simply stop reproducing as if it were as easy as turning off a light switch. So the emotional and practical implications of deciding whether to undergo genetic testing at a young age are inextricably woven. A positive test